Healthcare is an exceptionally complex system, an industry impacted by economies, politics, and social trends. How do those of us working and fighting for equitable and accessible healthcare for women and their families cope with these complexities? Welcome, GynoCurious listeners. I'm Dr. Amy Novat. From both sides of the speculum, we will investigate what it means to be a healer and to be healed. I want to welcome Wendy Stark, whose pronouns are she and her, to the program this morning. After spending the last 30 years in leadership and advocacy roles in the healthcare space, she is now the president and CEO of Planned Parenthood of Greater New York. Welcome, Wendy. Thank you so much for being here.
Thank you so much for having me, Amy. I'm thrilled.
I'm so glad. Good. Many of us who pursue healthcare as a career do so after events in our youth or our personal lives. Can you tell me, when did you first realize you wanted or were interested in healthcare, advocacy, policy, doing the work you've been doing?
Yeah, that's a great question. I think there's one moment in my life that I can point to as an example of something that happens to people all too frequently, and it was a defining moment for me. I was in college and I was back at home with my mom, and we were fortunate enough to have health insurance, which is something one has to say here in the United States.
Indeed.
And my mom and I both went to the same primary care provider. And my mom took me for a visit. I was either 18 or 19 or so. And I had recently come out as being a lesbian or a queer person, or whatever words we want to use. And I use both. And I had my visit and I was telling the doctor about some symptoms I was having. I had a bad case of mono in college, right? And I was still feeling some fatigue. And she was very abrupt with me during the whole visit and cold. And I hadn't remembered her as being that way in prior visits. And she immediately said, "We need to then test you for HIV." This was 1990. It was pre-antiretrovirals. But she had not asked me about my risk factors for HIV, and so her conclusion actually didn't make sense. So she didn't actually end up talking to me about my symptoms or where they might be coming from, and she did a pap smear for me that was really rough. It was a really unfortunate and unpleasant experience.
Yeah.
And afterward, I said to my mom, that was a really different visit than I'd ever had before. What changed, I wonder? And my mom said, "The last time I was here, I did mention to her that you'd come out." My mom was what we called, at least back in the day, a P-flag mom. She was really supportive.
Mm-hmm.
And I said, "Oh, that's it." And she felt terrible about it. And of course, it was not her fault, but that's what happened.
Yeah.
And so it was to me one of the defining things. I think my own experience in healthcare, my own experience of bias and poor treatment as part of it.
Yeah, all the isms that seem to affect far too many of us in our daily life and in our past that are important in terms of who we are, what we do, and how we see the world. Yeah. I'm so sorry you had to go through that. And I can't tell you how many people tell me, vulva havers tell me, that their first GYN experience was so impactful in the way they made decisions about their healthcare, sexuality, sexual experiences, their willingness to talk to doctors. It's far too common a story of trauma.
Absolutely.
Yeah. So speaking of isms and divisions, etc., unfortunately, after the 2016 election, during COVID times, and even now in anticipation of the next presidential election, we've experienced the loss of friends or acquaintances due to strong divisive opinions. The us versus them, you versus me attitude has become far too prevalent in the United States and American culture. Certainly in your professional work, I bet this has been very true. But has this happened to you in your personal life as well?
That's a great question. Certainly there are people in my personal life with whom I've had very strong philosophical differences, but often those philosophical differences aren't just philosophical. There are some belief systems or actions, of course, that can actually be extremely hurtful and harmful, including how one votes to the people in one's life. My personal strategy and opinion is that I actually try not to cut myself off from people, and I try to stay in relationship and believe, perhaps naively, that I can make an impact on how people think about the world through relationship. And so I really try to stay in it.
Yeah.
And that's not for everyone.
No, it's not. And in fact, I think it's probably easier on a human behavior level to just say, it's me against you, to create a divide, to be angry, rather than try to bridge the gap, figure out ways of communicating, find language that's not hostile and full of vitriol.
Yeah.
I thought about how your work probably involves a great deal of conversation with people, and that you go to events and you're talking to people who, if you will, you're preaching to the choir. These are people who promote choice, promote Planned Parenthood, etc. Are you ever in a situation where you're actually speaking to a crowd of people whose thoughts around your work are in question or maybe not so supportive?
I have not in this role yet been in that particular situation. However, I have in the course of the rest of my professional and personal life. Prior to coming to Planned Parenthood, I worked for many years at an organization called Callan Lord Community Health Center in New York City that serves LGBTQ people, not exclusively, but has a primary focus on the provision of LGBTQ plus healthcare. And in that role, there were many times over the years when I spoke to people about the importance of focusing on LGBTQ health because of differential outcomes and access and discrimination and bias and the policy environments that we live in and the way that living through oppression and discrimination affects people's health and health outcomes, and didn't have what I would call friendly audiences to those ideas. And there were many times when there was that question that comes up so often in the work of people who try to bring up inequality and inequities, which doesn't that mean you're getting special rights? And why would you build something that's for one group of people and not another? Isn't that antithetical to the whole premise of equality? And maybe folks who don't understand the word equity
or
in
inclusion.
Those sentences, or inclusion. And so really talking about why this wasn't trying to have quote unquote special rights, which is a phrase we've heard all too often in these conversations. And so the answer is yes, but not yet in this role, if that makes sense.
Yeah, no, it does. It does. And I can't help but think the experience in your former role was very formative and helpful in terms of how you address certainly issues around choice and all that's going on in our political arena now.
I would say that the right to reproductive health care and the right to LGBTQ health care, whether that means health care that is affirming of one's life and being, or if it is specific to the clinical provision of care, for example, the provision of gender-affirming care, are very similar and intertwined in the way that healthcare is thought about and delivered and regulated in this country and able to be accessed or not, as the case may be.
Yeah, it brings up a thought I was having. So often in this country, maybe throughout the world, the judgment around Planned Parenthood is, oh, they're only abortion providers. I want you to remind our audience, I know that Planned Parenthood provides abortion services, but it's a small fraction of what they do. Can you remind me what fraction it is?
That fraction changes, and I would say, and if we were only an abortion provider, and what? Abortion is such a critical part of what we do, while it is in volume, not the bulk of what we do.
Yeah.
It is so hard to access in other places. We also provide a full spectrum of sexual and reproductive health care, whether that's preventive care, including cancer screening and prevention, screening and treatment for sexually transmitted infections, breast and chest health issues, sexual function issues, all kinds of things that are critical to people's health and being and ability to participate in a healthy sex life.
Yeah. It's so striking to me that those who oppose Planned Parenthood are willing to just throw all of the services that you just described out with the abortion issue, the baby with the bathwater, no pun intended, excuse me. And it's so difficult to have a conversation with people around this. So what is your technique? How do you help people understand the broad scope of services and that health care is this huge umbrella that addresses so many aspects, again, of our well-being?
Yeah. The ability to make decisions about one's own body and have bodily autonomy is something that should, in many ways, should not have to be stated as explicitly as a human right as we do in this country. But the right to bodily autonomy, it cannot in any way, shape, or form be taken for granted in this country back to the enslavement of people that happened at the dawn of this country's being, and how much bodily autonomy was taken away from the people who were experiencing enslavement. And in our Constitution, I learned this. I'm gonna quote a source here, Dahlia Lithwick, who is a brilliant lawyer and observer of the Supreme Court and writer and podcaster and all the things, talks about how much the 14th Amendment of the Constitution, which came out of Reconstruction, has everything to do with bodily autonomy. And that she actually believes the right to bodily autonomy is enshrined in our nation's Constitution in a way that's really been denied thereafter. And so the right to take care of our bodies, to have our bodies be able to operate at their best, of the right to be able to be pregnant or not, is just so crucial to everything else in our lives, including our economic situations, our ability to pursue the lives that we want.
Yeah. I was going to bring up this issue of personal autonomy, and it strikes me, one, just to comment on the constitutional law that is being looked at and evaluated on so many levels right now in our country. And that when we're talking about, just to remind the audience, what we're talking about is the capacity to make decisions about your medical interventions based on your needs, wants, hopes, dreams, etc. And that the overarching world of medicine, your doctors, your parents, etc., they don't get to make these decisions. You get to make these decisions. And I was so struck recently, I had a conversation with an acquaintance who I know is very left-leaning, who believes very strongly about body autonomy and has strong feelings about healthcare, vaccines, strong feelings about what went down during COVID. But when I assumed that extended to abortion, said, oh, then you must be for reproductive choices, she said no. And I was stunned, one, because this is a very educated person, and I couldn't imagine her creating this divide between I get to choose whether I have vaccines or not, or I get to choose whether I want surgery or not, or I get to choose anything else with regards to my medical care. But the extension of women's capacity to make decisions about termination was not okay. What would you say about that?
What was the reason that this person gave?
Interesting. Good question. I asked her. Her partner was someone who had a very strong Catholic faith. And he had, she didn't use this word, but I guess I'd have to use it, convinced her that this was separate and apart from all these other autonomy issues. And unfortunately, we didn't have an opportunity to really dive deep into it. And I think she would have gone there with me. We were just in a situation that didn't provide for it. But yes, that's how she explained it.
Yeah. Look, I try to respect people's beliefs no matter what they are and when they're different from mine, right? Again, as long as they don't take those beliefs and then try to oppress me or others with them. And that family's right to make the decisions that they need for themselves and that fit with their spiritual beliefs is true too, right? And so I think it's really would just be staying in conversation with that person and talking about why their belief system shouldn't be imposed on others, which I think was likely that person's point about vaccines, and that's a complicated one. And there's a difference there perhaps between public health and private health decisions that we could talk about. But so often the decision about whether or not to carry a pregnancy to term, if one is able to do that bodily, is so impacted by so many other things, right? It is not just about our legal rights. It is about access to healthcare. It is about access to the adequate economics to care for a family. It is about all sorts of things. And the reproductive justice movement reminds us of this again and again, that our legal rights are only one aspect of this conversation and that the whole conversation is critical.
And just to further that what we're talking about is that there's so much data that demonstrates that when women have choice around contraception and reproductive choices, that the economy of their family, the well-being of their children, their education, risks of early neurological problems with children, job opportunities, et cetera, et cetera, et cetera, are being impacted.
Absolutely.
Yeah.
And if those things are being impacted for individuals, it means that there's an entire societal impact, and that the ability to have bodily autonomy impacts the whole economy and well-being of society.
Yeah, yeah. So let's go back. You mentioned this public versus private health. Can you further that conversation for us, please?
I think so often when we talk about vaccines, and very specifically the COVID vaccine, obviously there have been conversations about vaccines and vaccine mandates other than COVID, but COVID really brought this out so deeply. We, I think, don't have enough of an orientation toward public health and collective societal obligations writ large in this country, right? And so we think about things as so individualistic. This is about me, and I don't need to participate in a group effort to keep our collective society, our communities safe by this vaccine in my own body, right? And that, I think, comes from this idea. For some people, I think for others, there are different kinds of concerns there about the way, for example, that Black people have been really abused by the medical system, and the Tuskegee situation, right? There are some really rightful concerns that some members of our society are not being considered in thinking about the safeness and efficacy of medications, right? But this individualism is also part of it, and about what I get, it's a very libertarian, government should be out of my business. To me, that should comport with government out of my uterus, but it doesn't always.
Yeah, there's so much mingling and confusion and convenient separateness, and it's challenging. As I was thinking about our conversation today, I was thinking about how, what's wrong with our healthcare system? And there's so many aspects, and the experts, if you will, in healthcare in the United States have identified several issues as being the most concerning ones. Preventable medical errors, high cost, low quality, lack of transparency, and a difficulty of finding a good doctor and access to medical care. So, why do you think, given all of this, why do you think there's been so much focus in the political arena about women's health issues, but not on these issues, which potentially have some real ways of fixing?
There's a whole other thing that we could go into about authoritarianism and the relationship between a democratic society and bodily autonomy. And we could go there, but I will also say that our entire...
I wish I say it every single time I do a podcast.
But we could also talk about the fact, as you said, that our healthcare system, for all the reasons you said and more, is deeply broken in this country. And our healthcare system is not considered to be a public good. We have more uninsured folks in this country than in any other high-income country in the world. We think the way our healthcare system works seems to espouse a belief that not everyone is entitled to healthcare, that healthcare is not indeed a human right.
That's right.
And when we think about that kind of broken healthcare system and the choices that the clinicians in the healthcare system, and you being one of them, have to make about whether I practice and whether I join a large healthcare system or try to stand up a private practice in this very bureaucratically complex healthcare system, has everything to do with who I'll be able to serve from a financial perspective. And to me, yes, all those things you named are a deep part of how our healthcare system is broken, but I think the root cause of that is the economics of our healthcare system.
Absolutely. When you have big pharma and these large organizations that have essentially monopolized healthcare and whose primary focus is on their shareholders, the focus is the bottom line, and it's not about taking care of people. It's not about increasing access. It's not about addressing inequity. It's not really even about taking care of those who can pay with their insurances. So it's so broken, as you say.
Yeah.
And I don't pretend to know the answer. I really don't. I was reading an article discussing how femtech and technology people were approaching healthcare, and particularly how venture capitalism was entering this arena because there's so much money to be made. And most venture capitalists historically, and probably even today, I don't know that, but I suspect, are men. And when they were asked about female healthcare, when they were asked or talked about certain female healthcare problems, their response, quote, was, "Oh, I didn't know that was a problem," end quote, or "That doesn't really relate to me." And so as a result, they're not investing money in technology that is all around medical care for women. And the irony is that women are the primary healthcare users in this country. Women are often making decisions for their family, who they're going to see, what they're going to have done. They drive the economy of this. And yet their medical problems are of no concern or not my problem. And unfortunately, this is reflected also in the state of research and development in this country. Vulva havers are just female men. This is what's gone on for years in the world of science. And there are many examples of this. And it's only slightly changing now. And again, this is a conversation I've had with many of my guests. Oh, nobody in science wants to deal with hormones, heaven forbid. Nobody wants to deal with a woman who might get pregnant, heaven forbid. That there's all these so-called trappings or risks associated with studying women. I am just done with that. It's bullshit. It's just bullshit.
Yes.
What would you say to all that?
Well, I think that's not unrelated to the systems of oppression we've been talking about. In fact, in women's personhood is not valued in the kinds of, first of all, what's happening in the tech space and in the medical research space, but of course in the legal space. And we see all of this evidence in some of the opinions that have come out of the courts, including the Supreme Court's opinion in Dobbs about fetal personhood being at the, whatever that is, at top of mind and not the personhood of the pregnant person in any way, shape, or form. I think this gets back to the whole discussion we just had about public versus private health. I think that women and vulva havers' health is considered to be private. That is an individual thing. It is not the concern of society. That is your secret burden to bear. That is not part of public health and the health of society writ large, right? And so we've got oppression and patriarchy all tied in with white supremacy and racism and all kinds of other things over here. And then we've got this public-private dynamic, and those two things together make for a huge dearth in medical research about bodies with uteruses.
You may have seen this recently. Just this last week, I think, JAMA published a report that showed that rape resulted in 64,000 pregnancies in 14 U.S. states with near total abortion bans since Roe v. Wade was overturned in June of 2022. This was a peer-reviewed study. This was good science. And I remember when I read this, and I got very upset. And I wonder, how do you deal with the emotional component of the work? It's intense. So can you share with me your process?
Oh, wow. I can try.
Yeah.
This work can be, if you let it, in moments, soul-crushing. Absolutely. But it is also so buoyed by a number of things. One is the fact that we are providing care to thousands of people every day at Planned Parenthood of Greater New York. That looks like people who live in New York as well as people who are coming to us from states in which they cannot access healthcare.
Yeah.
And the fact that we are able to be here for them, that the amazing staff in our health centers show up every day amidst protesters, amidst all of those barriers, amidst at times threats or concerns about their own, in the case of our clinicians, their own licenses.
Yeah.
People are so dedicated to making sure that our communities have this access to care that they're willing to do that. And so both our staff and the people who come to us for care are super inspiring because people find their way to us no matter what. And in fact, abortion numbers have not gone down in the country since Dobbs, right? Which I think was meant to be the impact, not the only impact that was intended there, certainly. And that goes back to the question about authoritarianism.
Right.
And so those two things buoy me tremendously. And then just seeing how much people are willing to continue to fight for the world we want to live in every day, not only on the side of making sure people have access, but then preserving or developing the legal structures that we need to do that, and hearing from all the different ways that people are in the fight. And that looks a lot of different ways. And any way that people are in the fight is the right way for them, right? That buoys me every day more than the soul-crushing moments make me want to bury my head in the sand.
Yeah, yeah. We've talked about how the moment we let, if you will, them know that they've crushed us entirely, then the fight is done. So optimism that's not Pollyannish, a fight that's not violent, wishful thinking, and continue doing the work is so empowering. So yeah, I read this data, I felt despondent, and then I went to work. Then I just said, okay, the job continues, and that's the way in which I can fight on a personal level and a professional level. Are you having trouble getting docs and nurses and MAs? Are you having difficulty getting staff?
Yes, but not for the reasons that you might guess. I don't think that our trouble in recruiting staff has to do with our mission. I think it's quite the opposite. I think actually people come to us because of our mission and because we do the work that they want to do and that they believe in.
Mm-hmm.
However, our healthcare system, back to that, is deeply broken.
Yeah.
And people have stepped out of the healthcare sector.
Yes.
Right? Whether that's physicians or nurses or folks that work in supportive capacities. People got very tired and burned out and were relied upon in ways that were inhumane during the COVID pandemic.
Yeah.
And so we need to build back up muscle in the healthcare sector about creating sustainable jobs for people and about drawing people to the profession. And that is a long road, and we have to work on all the angles at once, getting our healthcare system to a better place and thinking about that, from the point of view of our individual practices or organizations.
Again, it's that merging of public and personal. And
absolutely.
For me, it was really the first time anyone ever discussed the well-being of the practitioner during that time, during COVID. That all of a sudden there was this conversation about burnout, moral injury. And I realized that for so many years, after such rigor in my residency, et cetera, where there could have been discussions about how we were doing emotionally, how we were doing physically, how we held our arms in the middle of a 5-hour operating room case and didn't injure our necks or our backs, that none of those conversations were taking place for decades and decades. And so my hope, my prayer is that in reviewing the events of COVID and how it impacted our practitioners, that part of the way we fix, if you will, the system is saying we need to make sure that we take care of our communities of practitioners who are individuals and whose jobs have different demands physically, emotionally, spiritually, and that we need to speak out loud about it because there's been this mythology around people in healthcare that they just keep going and they can take it all and that they're not human beings. And of course we are. We are.
I think our healthcare system and the economics of it do a lot of dehumanizing, including to the people working in it. Absolutely.
Yes.
And when the ability to maintain a practice or an organization is based on the volume of care you can provide, it is so the wrong incentive. It is the wrong way to finance healthcare. And so there are these root causes there again that we have to go back to, and increasing the humanity in all aspects and how care is provided and how care is provided to the folks providing that care. All of those things are a critical part of how we have to move forward.
Yeah. So with all this in mind, has Planned Parenthood as an organization nationally and in the greater New York area really had to reevaluate their business model, their approach towards healthcare?
Yes, and that looks very different for those of us sitting in states where we still have access to our human rights and states where our human rights are not offered, right? And so for my colleagues sitting in banned states where they can no longer provide abortion services, and we fear about some of the other services like contraception, and certainly gender-affirming care, likewise to abortion, has been banned in many states. Of course, how they're offering their services and how they're sustaining those practices and showing up for their communities has changed deeply, right? For us sitting here in an access state, it is more about how do we make sure we're standing up all the capacity that's needed to care for people not only in our state but beyond, and how we're shoring up the policy and legal environments in our access states to make sure that we stay access states. So here in New York, as an example, and this is something we're using around the country, there is a ballot initiative that will go to the voters in November of 2024, which will enshrine the right to be free of discrimination based on pregnancy or pregnancy outcomes in the New York State Constitution. And when we've seen bodily autonomy go to the voters in a ballot initiative in Ohio, in Virginia, in Kentucky, voters have to a one in those states voted for their rights. And that state constitutional work is one of the strategies about keeping our rights intact right now, one of many, right? And standing up capacity for those of us in access states, making sure we have great patient navigation systems so that we can help people get the care they need no matter where they live. Those are all the strategies that we're undertaking.
Yeah. What you've done so beautifully this morning is weave the realities around the broken healthcare system with the recognition that healthcare is a global need, that it's global for our body. We're not just talking about choice around reproduction, although that is part of it too. And that I just want to remind our listeners, if you are listening to us this morning and feel tempted to turn off the radio or your computer because you don't want to support choice, I want to remind you we're here to talk about all of our decisions around our body, all of the conversations we have with our clinicians, all of the legislation out there that is insidiously breaking down opportunities for not just vulva havers, but the full spectrum of human beings out there to make decisions around their body. And hey, certainly in the face of emergencies, we want our doctors to make decisions for us. Okay. But the majority of times that we're making decisions in the healthcare arena, it's not in an emergency. And it is an opportunity to ask questions, look at options, figure stuff out. But you want that opportunity. You want that right.
That's right. And for that to not be a privilege, so many people can't get even the most basic healthcare in this country.
Yeah, the inequities, the certainly what we know about women of color in this country who not only have limited access, but we're looking at morbidity and mortality rates that are skyrocketing. And we have to start really asking ourselves, what do we do to repair this? What do we do? Yeah.
And there are lots of answers. And I would say one of them is voting.
Yeah. Yeah. Thank you for reminding our listeners. I think it's so important when we feel disempowered. And I know I've met many people who say, oh, my vote doesn't count. It does. It does. It does. I always hark back to a local election we had in a small town nearby where one vote made a difference in the mayoral race. And one vote,
Yeah.
one vote.
Yeah.
Yeah.
Justice is all of our responsibility. Absolutely.
So how do we advocate for ourselves as individuals and our communities, that personal and public sphere? What do you think advocacy looks like in both those arenas?
As I said a few minutes ago, any way that people are engaging in the pursuit of human rights is the right way for them, whether that looks like individuals having conversations with their friends, family, neighbors about the critical nature of healthcare access and bodily autonomy, whether that looks like people standing outside of reproductive health clinics and ensuring dignified access for the people trying to go in for care but being met with protesters, whether that looks like people doing poll watching at voting booths, whether that looks like people engaging in campaigning for the ballot initiative that's coming up this November in New York. There are so many ways to get involved and to be in the fight, to be in the movement, and all of them are critical.
Yeah. And additionally, when you're in your doctor's office or you're seeing your clinician, whomever you're seeing for healthcare, you have the right, the responsibility, the opportunity, I hope, to say thank you, no thank you, or this is the way I'm thinking about it, or this is the way I'm feeling. I feel so strongly about it because I can't tell you how many times I hear women in my office say, first of all, nobody ever asked me those questions, or two, the doctor just never really listened to me. And I hear it over and over again. And I sympathize with my colleagues because,
Yes.
again, we're being asked to see people in a very quick time frame, excuse me. And again, clinicians are feeling a great deal of pressure around all aspects of their public and professional lives, excuse me. But as patients, we need to learn how to really speak up. And it's hard. It's so hard because when we don't feel well, it's scary.
And so many of us have been taught that our bodies and how they feel just doesn't matter, and that we don't have the right to say stop, slow down, or no.
Yeah.
Right? And that is critical in internalizing that right and learning that and unlearning what we have actually been taught is really critical to that experience in the exam room. You're absolutely right.
Thank you for pointing that out. It's so true. So true. So we have to start with our sons and daughters when they're young and empower them with the voice to speak up. And if they're told, oh, you talk too much or you ask too many questions, which my daughter experienced, I have to remind her, you just keep asking. You just keep asking because no one has the right to shush you.
Absolutely. And a comprehensive health or sex education curriculum in all of our schools at those young ages is about here is your body. Here is your right to consent.
That's right.
That is what sex ed is at that age, right? And not everyone likes to hear the word sex ed related to a young child. But that's what we're talking about, is that your body is yours and the right to say no is your fundamental human right.
And moreover, one of the things I also talk a great deal about is why can't we talk about vulva and penises and uteri and breasts? We talk about eyes and ears and toes and noses. What is it about the hypersexualization and the shaming and the taboo around our bodies, particularly as vulva havers? And that has to change.
As if that's a private secret thing, right?
Yeah, exactly.
Absolutely.
Exactly.
All tied together.
I also want to just reiterate that for those listening, that when we talk about certain policies, particularly around choice, that Wendy has pointed out that often the decisions around choice are then moving into contraception options, moving into healthcare options, that there's connection in the fight against autonomy that is looking at getting rid of these options for people.
That is 100% true. And so we all have to understand that the loss of rights is a slippery slope.
Yeah.
And that we have to fight back against it so that it doesn't continue to creep toward us.
Yeah. I've been asked several times by people, what do I think about the fact that the birth control pill is going to go over the counter? And I think they're shocked when I say, Yahoo!
Absolutely.
I think they think, oh, I'm going to lose business, or am I concerned about risks, et cetera. But this isn't first of all, there's so much science speaking to the safety of these products. And hopefully, if we bring it out to the public in a way that educates them, again, allows them to ask questions on an individual level, breaking down some of these rules and regs that are keeping people from contraception options that should be available to everybody.
100%.
How come condoms are available to everybody, but
Yeah.
That's as we move towards closing this morning, is there anything that you want to make sure that we say out loud to our audience that we haven't spoken about?
I think we hit a lot of things today. Thank you for the really comprehensive conversation. I would say the biggest thing is that the loss of hope is something we all have to fight against. And we have every reason to hope, right? We have a long game here where we are in a long game. There are so many of us in this fight together in the ways that we're in it. And we will eventually prevail, even through these scary times. Despair is something we have to resist, and we have to do that together. That's not a project that one does alone. And so in community, in relationship is the way to hold on to hope.
So a segue to that is I like to talk about pleasure, because so much of what we talk about on GynoCurious is serious stuff.
Yeah.
And when you're not working, which I suspect is not a whole lot, but when you have downtime, what gives you joy? What gives you pleasure? What allows you to just zone out?
Oh, my kiddo and I love to play different kinds of games, whether that's board games or games of imagination. That always gives me pleasure and hope. There are two big dogs in my life, and they give me a lot of pleasure, and their goofiness is just, it makes me smile endlessly. And being with the people I love and care about in the world, and when I have moments reading, always sustains me.
Yeah. Well, may there always be an abundance of all those things in your life.
Thank you, likewise.
Yeah. Wendy, thank you so much. Thank you for your bravery and your spirit and your willingness to put your own time and energy into the well-being of our communities. Thank you so much for joining us on GynoCurious.
Thank you, Amy. So great. Such a great conversation. Thank you.
And thank you to my listeners, my producers, Jen Hammoud and Matty Rosenberg, and to the Epicurean here in Rhiniecliff, New York. Please come visit it. It's a wonderful store supporting local products that are meaningful to our world and our earth and our well-being. Please let me know what you're thinking by emailing me your comments at radiofreerhiniecliff.org or call us at 845-307-7446. Please consider going to Apple Podcasts and giving GynoCurious 5 stars and a comment, please. This helps spread the word on my show, but also Radio Free Rhiniecliff, and like us on Spotify. Please stay tuned so that we can continue to be endlessly curious together on GynoCurious. Until our next conversation, be healthy. Please remember to relish your instincts and intuitions. They are great teachers, not to be ignored.